Hi, my name is Heather, and the leadership conference topic that I chose was conflict resolution. I chose an article from the Nursing Management Journal titled Keeping the Peace, Conflict Management Strategies for Nurse Managers by Mary Johansson. I have been an emergency room nurse for over 11 years. I am currently the weekend night supervisor in the emergency department. As you can imagine, with the fast-paced environment and the high-level acuity of patients, the emergency department can be a funnel for high levels of conflict. Conflict is inevitable, whether at home, at social situations, or at work. At some point, there will be disagreements amongst the parties. Conflict resolution is important for all interpersonal relationships, but it's especially important within the healthcare organization. It is such an important issue that in July of 2008, the Joint Commission issued a Sentinel event alert. It was determined that poor communication, lack of teamwork, and ineffective management of conflict were top contributors to Sentinel events. Effective conflict resolution results in improved quality of care, patient safety, improved staff morale, and it limits work-related stress. Workplace relationships in healthcare are important. There must be trust and effective communication between the collaborative team members to be able to safely care for the patients and provide better outcomes. Interpersonal conflict within the healthcare organization can include the patients and families, amongst your peers, the physicians, and even management. There are different styles of handling interpersonal conflict. The article describes these as dominating, obliging, avoiding, compromising, and integrating. And while there may be many situations where some degree of all of these styles of conflict resolution may be beneficial, generally the more appropriate or preferred styles are integrating or compromising. Integrating brings together all the ideas of the parties involved to come to an acceptable resolution for everyone. Sometimes an absolute resolution that benefits all parties is not possible. This is where some degree of compromising can provide the best resolution to the conflict. The article addresses techniques for conflict management strategies specific to nurse managers, but effective conflict resolution is important for all healthcare professions. In healthcare, we must work as a collaborative team to care for our patients and families. We must build trusting relationships with the physicians, management, and our peers to collectively provide safe patient care. There are important steps to help achieve conflict resolution within the workplace. First, we must recognize conflict early. Look for the verbal and nonverbal cues amongst the staff. When potential conflict is recognized, we must be proactive to address the issue at an early stage to prevent it from escalating. Do not avoid the conflict, rather establish a rapport and a trusting relationship with others to be able to openly communicate before the situation escalates. When communicating, we must actively listen. This involves trying to understand the situation, interpret what the speaker is saying, ask clarifying questions if necessary, but be engaged and use clear, effective communication. Remain calm during the situation. Remember to keep your emotions in check, control the situation, and avoid escalation. Do not be afraid to request a cool down period if the tensions begin to rise. The conversation can be resumed at a later time once all the parties are able to effectively communicate. We must be able to clearly identify and define the problem at hand. Use clear communication to minimize misunderstandings, and finally seek a resolution. When possible, try to actually seek out an acceptable resolution that meets the goals of all the parties involved. Allow all the parties to be heard and clearly communicate the reasoning behind the decided resolution. I hope this was helpful in preventing and resolving conflict resolution within the healthcare organization. Thank you.